Today's presenter is Shawn Fong. Shawn has worked for the City of Fremont's Human Services Department since 2002 and is the Program Manager for Transportation and Mobility Services for Seniors and People with Disabilities. She oversees the Fremont Paratransit Service Program, which provides paratransit services to Fremont and Newark residents. Additionally, she was instrumental in developing and implementing the Tri-City Mobility Management and Travel Training Program, the Tri-City Taxi Voucher Program, and the Tri-City Volunteer Drivers Programs. She works on local and regional transportation planning to ensure that seniors and people with disabilities have access to high-quality, affordable transportation services.
I bet probably most of you in this room this evening drove here tonight, right? Yeah, okay. And I think it's quite apropos that I'm actually on the evening that there's going to be discussion about medication safety as well as nutrition, because there are ways in which medication safety as well as nutrition tie in very much to issues around driving safety. So I like to sort of think of myself as the go-to person. Myself and Pamela Gutierrez, who's here in the audience tonight, both of us work with the City of Fremont, and we are very well versed in helping folks to sort of assess their transportation situations and figure out what resources might be best suited to them. When we talk about driving safety, there are a lot of kind of very sticky situations that come up around talking to a loved one about driving safety. So I want to, let you know that there are lots of resources that I brought with me today in the back of the room that will help people in initiating this conversation. Many people spend a lot of time focusing on their planning for their retirement from work, but not very many folks look at what does it mean to retire from driving? And what does it mean how do I know that I get to that point where I might need to either cut back on my driving or actually give up the keys entirely? And these are very difficult questions and conversations to have with our loved ones. I recently went through my own personal situation with my mom after a number of sort of changes in her health situation to initiate these conversations about, hey mom, I noticed that you've cut back on your driving. You don't drive at night anymore. You're seeming to drive just in the local area. Are you concerned about your driving safety? And really use things that I observe, being in the car with her, spending time with her, noticing day in and day out kind of the little changes that happen with her health, things that she'll mention to me. I'll use those as sort of stepping stones to having conversations about what's going to happen at that point where she's not going to be able to drive. The research these days is showing that many seniors are outliving their driving ability by 7 or more years. And a lot of people don't like to think about that because what's going to happen once someone gives up the keys? We're very, very fortunate to actually be in an area, if your loved one is in the Tri-City area, Southern Alameda County, we have actually built out a lot of transportation service programs to support people in making sure that they can get around in the community. Because when we talk about driving safety, we have to really understand at the deepest level what it means for someone who is a driver. What does having the keys, what does being able to get up in the morning, get in the car, go to the senior center, being able to get oneself to a doctor's appointment, et cetera, what does that mean? That sense of independence, that sense of freedom, all of that is really important to understand in terms of any conversations we're going to have with folks around driving safety. Having conversations and thinking about, when to cut back on driving, when to stop driving is always going to be that balance between looking at safety versus independence. When we think about driving safety, I mean, it's pretty, straightforward, looking at the kinds of things that we need, the skills that we need to maintain our safety as a driver. We need to have the physical abilities to be able to move our bodies, right? To be able to have that flexibility in our neck, to look over our shoulder when we're, doing lane changes or backing up. Being able to, quickly move our foot from the gas to the brake. We have to have good vision, right? We have to be able to have visual acuity, a sharpness in our vision to really see our surroundings and assess our surroundings. And of course, with these driving skills, we also need all the cognitive functions that are necessary, having good judgment, awareness of our surroundings, using our perception, our judgment, intuition, and our memory. And certainly, as we age, there are a lot of common things that change that will affect our driving ability, from eyesight problems. I recently went to the optometrist, and she said, "Whoa, look, you have the beginning of a cataract." And I'm like, "Oh, well, that's interesting, but good to know now." Good to have those regular vision exams. It is recommended for seniors to have their vision checked once a year, because vision problems are one of those situations where sometimes might be fairly easy to correct. It may be because, maybe our prescription for distance is off a bit, and so it might be as simple as a correction in the prescription for our eyeglasses that will help improve our driving safety. There are some other things that, we may be able to take steps to manage, things like slower reaction times. I always counsel folks on the more people stay physically fit and active and exercise and all of that, the better shape our bodies are going to be in, not just for our own health, but also for our driving safety as we get older. And that also connects in with loss of muscle strength and flexibility. The more you stay active and fit, the more we'll be able to maintain our driving safety as we age. So even though these are common things that might occur as someone gets older, a lot of people come and say to me, "Well, my dad or my mom is, 70 something or 80 something, he or she should stop driving." And I say, "Well, why? Is there something that you've noticed about their recent driving that has prompted you to be concerned?" I've seen some folks who are in their 90s who are better drivers than other folks who are much younger. So age alone is not necessarily an indicator as to whether or not someone is a safe driver. It is, how attentive are they on the road? It is, how aware are they of their own driving abilities, right? One of the wonderful things about older adults in terms of their own reflection on their driving abilities is that they're able to modify to go, I don't quite feel as safe driving at night, or I don't feel quite as safe driving on the freeway. So we tend to see with older drivers, not all, and we'll talk a little bit about what do you do when there are driving safety concerns where someone is not modifying their own behavior. But a lot of times people will do those things like cutting back on the night driving. They'll cut back. They won't go out. I had a senior tell me once, who lived right near a high school, that she doesn't drive when school starts in the morning or when school gets out in the afternoon. I had another senior talk to me about, they don't like making unprotected left-hand turns where there isn't a left-hand turn signal, because that sometimes it's harder to differentiate and tell like how fast a car is coming, or people doing sort of crazy things and not yielding the right of way if you're already sort of partially making the turn. So there are lots of things that people can do in terms of modifying their driving as they get older. But knowing when to sort of do that modification or when to actually give up the keys and look at other driving alternatives is sometimes, it's going to really depend on each person's situation. There are lots of health conditions that affect our ability to drive. The most challenging, though, is when it comes to someone who's dealing with Alzheimer's or dementia, because one of the effects of someone who has dementia is that their own ability to assess their own skills and their own situations and their own abilities is diminished by that condition. So that's a little bit more challenging. So when I get questions from folks about, if you're trying to help a loved one look at their driving skills, one of the things I tell people is, well, go take a drive with them. Rather than you automatically jumping in the car and being the person that drives, say, yeah, go ahead, Mom, Dad, you can drive today, and really get a sense of how that person is doing on the road, because the research shows that that people are more receptive, loved ones are more receptive to feedback about their driving and issues about driving concerns when that feedback is coming from someone who's actually seen them drive, right? It's good to keep a written record of what you've observed about behaviors over time, because just because one behavior that you see, maybe not quite coming to a full stop at that stop sign, doesn't necessarily constitute terrible driving safety. As I see some people kind of looking away, how many people have done that, right? But it's the pattern of what you see that really constitutes, is this person a safe driver or not? I'm not going to get into, what people, things that, whether or not you adhere to exactly every single DMV rule or vehicle code regulation, but the rules are out there for a particular reason. So if folks aren't sort of paying attention to what the rules of the road are, or seem to be confused, those are, again, signs about, over time, a little pattern here, a little pattern there, to say it's worth having a conversation. So we talked a bit about modifying driving behavior, and I would say that if you see your loved one modifying their driving behavior, that's also a good place to step in and have a conversation with them about, oh, I noticed you doing this. Are you concerned, or has night driving gotten more difficult? Use those things that you observe or they mention to you as a way to continue the conversation about not just their driving safety, but about the planning piece of what might happen. Not necessarily like, okay, when you get to that point where you have to give up the keys entirely, but what might happen if something were to necessitate hospitalization, or you're being out of commission for a short period of time. Putting into place some alternatives for those temporary situations, and then using that as a platform to talk about more longer term plans when people have to actually not drive anymore. When we talk about driving concerns, there are a list of different kinds of warning signs for driving problems. Some of them are pretty obvious. You notice some bumps and nicks and scratches on mom or dad's car or your spouse's car, and it's like, well, how did that get there? And it might be indicative of some issues with their ability to really manage backing up, parking safely. Other kinds of signs involved, incorrect signaling, trouble navigating turns, moving into the wrong lane, confusion at exits, getting lost in familiar places. That just, every day they turn right onto Paseo Padre, and this time they missed Paseo Padre, or, little things like that are big warning signs. Things like driving at inappropriate speeds. If the speed limit is, 35 and they're driving at 10 or 15, or excessive speeding, or driving at slower speeds on the freeways. Delayed responses to unexpected situations is also a concern area. Not anticipating dangerous situations. I see this a lot with pedestrians, older drivers and pedestrians, and not, paying attention to the cars, but not necessarily paying attention to other things in the environment. So all of these things are, again, good pieces to observe and to note and to use as to have that conversation with your loved one. There are a lot of things that people can do If they have a loved one who they're really concerned that this person might need to cut back on their driving or might need to stop driving. And first and foremost is, again, talking to the individual, because folks will be most receptive to a family member. It's been shown, the research has shown that most receptive to talking with a family member who they trust and feel like has their best interests at heart. Now, I know that sometimes, family relationships might be contentious, and there may be folks within the family that may have more ease at talking with a loved one, so it might be talking amongst family members to look at who might be the person that might be best suited to have this conversation in a way that is not about putting the other person on the defensive, but about looking at what's being observed and looking at trying to make alternative arrangements if need be. Additionally, you can use healthcare providers as folks who can have conversations with your loved ones. I know I have been to the doctor many times with my mom, and as he is prescribing a new medication, her cardiologist was prescribing a new medication. Well, how does that affect driving safety, and is there drowsiness? Are there things to be concerned about with this new medication with respect to operating a vehicle? So there are different ways that you can, particularly if you're already involved with your family members' healthcare providers, that there are ways you can tap into using that person to have conversations. Healthcare providers are required by law with certain kinds of conditions to report them to the DMV with respect to that person's driving safety and possibly they're having to have their license suspended or revoked because of their health condition, whether it's a temporary health condition or something that is permanent that is going to affect their driving ability ongoing. You can certainly come and talk to either myself or Pamela with the Tri-City Mobility Management Program. We have had numerous conversations with family members about these kinds of situations and how best to have the conversation. And sometimes it's about, for us, it's stepping in and really explaining the alternative transportation resources that are available so that people feel like if they're giving up those keys, they're not giving up their life, right? So use us, and we're happy to talk to your loved ones. Additionally, you can request to have your loved one assessed by a driving rehab specialist. These are occupational therapists that have specialized training in looking at all the skills that are needed for someone to be able to maintain their driving safety. And last but not least, you can request a reexamination from the DMV. If they're really sort of serious concerns and you don't feel like your loved one is sort of being responsive to those conversations and either cutting back on their driving or looking at alternative transportation resources. I did bring with me in the back, there's a publication that the DMV puts out called Potentially Unsafe Drivers and how to report a potentially unsafe driver. And you can actually fill this form out with specific concern areas that you have, and the form lists those areas. You write your name, your address, your contact information, and if you want that to remain anonymous, so that the DMV would then request that the person come back in for a reexamination, and they're not required to divulge where that report came from. So, and I'm more than happy to talk to folks about this. This is kind of the last resort in terms of how to deal with someone, particularly if they're reluctant in looking at their driving safety issues. So let's switch gears a little bit and talk about, what do you do if you've got someone who you want to help get your loved one linked up with alternative transportation services. So we offer with the Tri-City Mobility Management Program individualized transportation planning, information and referral services to individuals in the community, seniors and folks with disabilities in the Tri-City area. And also, if we get someone from outside of the area, we will also meet with them and talk to them about resources. But what we also do is we specifically link people with whatever transportation resources are available in our community, whatever is most appropriate for them, or perhaps a multitude of different programs. We can do those consultations over the phone with your loved ones. We can do it in person. On occasion, we've done home visits because sometimes folks are more comfortable in their own home setting. And we also go out to the various senior centers within the Tri-City area. Some of the programs that we have that we can refer people to is if we have an individual who is physically fairly in good shape and can walk and manage kind of figuring out some trip planning stuff, we can help people actually learn how to use the public transit resources in our area. So that's the local buses and the BART. I had a senior a few years ago come to me who was in her late 60s who said, I'm just, the car's getting expensive to maintain and insure and all of that, and I have a bus stop that's really close by that I think goes to the senior center, and I want to learn how to use transit. And we were able to work with her, have her go through a workshop and do some individualized travel training sessions to help her know how to actually take the bus, not only to get to the senior center, which she went to practically every day, but also how to get to her doctor's appointment here in the central part of Fremont, and how to get to some other places as well. So we offer the travel training program and both group workshops to get people familiar as well as individualized training. And I'm not going to go through this as much, but the training that we do on public transit is everything, all the essentials of what people would want to know about actually riding transit, paying for fares, using their Clipper cards, planning a trip, and providing assistance to folks for specific trips that they want to learn how to do on transit. Most of the requests that we get for transportation services get directed to our other supportive transportation programs, and primarily we're looking at paratransit. So paratransit services are door-to-door transportation services for seniors and people with disabilities who otherwise don't have the means of getting around in the community. There are two kinds of paratransit services in our community. One is what is referred to as the ADA Paratransit Service, which is the Americans with Disabilities Act required that public transit agencies had to provide door-to-door paratransit services for people who were disabled and couldn't use public transit. So that's what we refer to as the ADA Paratransit Service, and for our area that's East Bay Paratransit and Union City Paratransit. We also have local paratransit services operated by the city of Fremont for eligible Fremont and Newark residents. So the ADA services, East Bay Paratransit serves all Tri-City area residents and also outside of this service area because they're a large paratransit service provider. And then Union City Paratransit primarily provides paratransit services within Union City, within just the Union City area. So paratransit services, as I mentioned, are door-to-door services. They're shared ride services. They typically require an application and certification in advance before someone is able to use that service. And the services are accessed by making advance reservations. All of the paratransit services in our local area are wheelchair accessible. So if someone has need for either if they use a wheelchair or a scooter, they're able to access those vehicles. The fares for paratransit are very low costs, and there are no limitations on trip purpose. So if the person wants to go to the senior center or go to the doctor or go get their hair done once a week or whatever it may be, they can use paratransit services to get to all of their transportation needs. And the other common feature about paratransit is that personal care attendants, that is someone who travels with the individual who's providing them with any assistance that might be necessary for them when they're traveling out in the community. Those individuals travel at no cost. Let's see here. Some of the major differences between the paratransit services, East Bay Paratransit, Union City Paratransit, and Fremont Paratransit, is that there are some different applications and eligibility requirements, service areas, service hours. What I say to folks is that if you have questions about someone who you're trying, a loved one who you're trying to link up with services, this is where we come into play, where we can actually sit down and do that individualized transportation planning so that we know, your mom likes to go to the senior center Monday, Wednesday, Friday, or, dad likes to meet up with his old golf buddies at so-and-so restaurant, or whatever it might be. We get specific on what it is that your loved one likes to do, and then we try and figure out which services in the community, whether it's paratransit, we work with folks and help them fill out the applications that are needed for the different services that they're going to be using. And we do that hands-on, and we do that where we explain actually how to use the service so that someone doesn't just get an application and say, okay, well, fill this out, send it back to us. We explain how to use the service. We will actually walk folks through in terms of when they're using the service the first time, how to make reservations, how to plan their trips, how to use the services effectively, what's the difference between using paratransit versus some of the other transportation service programs that I'll talk about. I'm going to skip through some of this in terms of the eligibility, because I feel like rather than kind of overwhelm folks with what the eligibility is for the program, really kind of refer folks to us. Keeping in mind that the ADA paratransit services are disability focused only. You have to prove that you're disabled and unable to use public transit in order to qualify for the East Bay Paratransit or Union City Paratransit programs. With East Bay Paratransit, they do require an in-person certification appointment where the person actually has to go in and meet with an East Bay Paratransit staff person. Those assessments can actually be done here locally if your loved one lives in the local area. The East Bay Paratransit staff are at Fremont City Hall every Friday. So rather than having to take them all the way up to East Bay Paratransit's offices up in Oakland, those appointments can happen locally. Union City Paratransit just requires a mail-in application. Once someone is certified with the ADA Paratransit Services, that certification is good for a 3-year period of time. And if your loved one travels outside of the area to another location, they can access, if they're certified with ADA Paratransit Services, they can access ADA Paratransit Services throughout the entire US. A little bit about fares for the paratransit services. East Bay Paratransit is distance-based. So it's $4 for each trip up to 12 miles. East Bay Paratransit service area is quite large. So the further someone goes, the more expensive those trips are. With Union City Paratransit, as I mentioned, they're just within the Union City area, and those trips are $2.75 per trip. So when you consider the price of gas these days and all the other costs of owning and maintaining a vehicle, looking at the alternative transportation resources are actually quite economical. When we talk about where the services are offered for the East Bay Paratransit and Union City Paratransit, they will offer door-to-door transportation services anywhere within 3/4 mile of an active bus route or BART station within the service area. And they operate the same hours as do those bus routes that are operating in that area or the BART station. So if someone lives on an AC Transit bus line that operates from 5 in the morning till 10 o'clock at night, they're going to be able to access East Bay Paratransit service during those times. If they're in an area that has no bus service on the weekends, then they're going to be out of luck and not have paratransit services on the weekends for the ADA services. But we'll talk a bit about some of the other the Fremont Paratransit Service. So our local Fremont Paratransit program is a supplement to the ADA Paratransit Service System. And again, we provide rides for healthcare, shopping, errands, social, recreational needs that people might have. The eligibility is Fremont residents 80 and older or unable to use public transit because of a disability, or Newark residents 70 and older unable to use public transit because of a disability. So there are some limitations with our program. We go just within the Tri-City area, and there is a limit as to how many trips people can take per year, and that's a maximum of 208 one-way trips. And you might go, well, what does that really amount to? So essentially, if you divide that out equally across the year, it's about 2 round trips per week, which for some people is fine. Other people, they may need to supplement with other resources. And our service charges $2.50 per one-way trip, which again is fairly inexpensive. Our services for the Fremont Paratransit program are available weekdays, 8 o'clock to 6 p.m., and then weekends, very limited service, only 9 to 3. We have found that our folks that are enrolled with us, their need for paratransit services really occurs during the weekdays, a lot of times when loved ones, family members are working or have other commitments. So we concentrate our service availability on the weekdays for our local Fremont service. Again, it's by advance reservation, and for our service, unlike the ADA Paratransit program, our calls are reserved first call, first served. People will ask, well, you know, what kind of help can the drivers give to my loved one? The drivers can do a bit of assistance to the riders on paratransit, whether you're talking about the local Fremont program or the ADA Paratransit Services. And they can provide help with the person getting on and off the vehicle, carrying small amounts of packages, et cetera, but they're not allowed to go into a person's residence or actually help them with any personal care needs. A couple of the other programs I want to mention that we also provide are subsidized taxi vouchers for anyone in the Tri-City area who are older than 80 years of age or older or unable to use public transit because of a disability. This is same-day transportation service. It is unfortunately not wheelchair accessible because there aren't any wheelchair accessible vehicles in our area. And it works a little bit different from paratransit in that people will buy taxi vouchers at a cost of $4, and then that voucher is valued up to $16 in taximeter fare. So it's a partial subsidy for taxi rides. But it's a great program. A lot of people like the ability to call up on the same day and get a ride, or if they're going to the doctor and they've made the paratransit ride to get to the doctor's, but they want to take the taxi coming home because they don't know how long they're going to be at the doctor's office. And, you know, so therefore it's hard to schedule that return ride home. In addition to the taxi voucher program, there are a couple of volunteer driver programs in our community. One is called our VIP Rides program that's provided by Life Elder Care, which also does Meals on Wheels and some other services for older adults and people with disabilities. And the VIP Rides program is specifically for people who need destination assistance once they are out in the community. So they have volunteers who will take people in their own cars to doctor's appointments, errands, shopping, and provide them with the necessary assistance. So for example, someone who might have some vision issues and they're going to the doctor's, the volunteer will provide transportation in their own vehicle and act as a sighted guide for the person. They might also provide a steadying arm as they're walking and negotiating steps and the environment that they're in. They will also help with carrying packages and actually bringing groceries into the home. So it's a wonderful program, and it really fills that service gap of not having friends or loved ones not having friends or family members at a given time to accompany them on trips that they might need. And then last but not least, we have our volunteer driver program known as the Drivers for Survivors, which is specifically for cancer patients who need transportation to and from cancer appointments. Thank you.